Oral health, so critical. It's important to visit your dentist regularly to avoid those potential problems. And our great friend of the show, Dr. Marci Guthrie, is back with some tips along with some visuals as well. Great to see you again, Dr. Guthrie. It's nice to see you.
Thank you for having me.
We're talking periodontal disease?
Yes.
Okay, periodontal disease. What is it? We know it starts here in the mouth.
Correct. So periodontal disease is an infection of the gums. It is chronic. There is no cure for periodontal disease.
There's no cure.
No cure. So it's about monitoring and maintaining the disease. It is contagious. So sharing utensils or kissing with your significant other can pass the bacteria to your significant other. Also, it is silent. So you know, most people don't know really that they have the disease.
All right. First of all, what can we do to prevent this?
So to prevent periodontal disease, you can lower your risks. Smoking really increases your risk, but sometimes genetics just plays a part in that, and you're naturally prone to having it. Age, 65 and older, over 70% of people have some form of periodontal disease. Also stress, diabetes, your health can leave you more prone to having it.
Stress can lead to it as well? So it begins in the mouth. How does it affect the overall body?
So we've got these bacteria that constantly causes inflammation, and the goal of treatment is to maintain the bacteria, control the bacteria the best we can, and control the inflammation so that it doesn't affect our systemic health. So that means regular dental visits.
So we have this as bacteria.
That is the bacteria.
It travels from the mouth. Does it travel to a particular place in the body?
It can travel to all different places. It's been linked to heart disease, stroke, diabetes, Alzheimer's. They're finding these oral pathogens in brain tissue, in cardiac vessels. So
we have some images here. There's an X-ray. Is this X-ray that we're going to be seeing here momentarily, is this a healthy gum, healthy tooth right here, or is this something that has a periodontal disease starting?
So there's some tartar buildup that has been circled there that needs to be cleaned off at the dentist regularly. The red line is where the bone level should be, and then I've drawn an arrow down to where you can see the bone levels have deteriorated. So if we have no bone, we have no teeth, and eventually, you know, you can get infection or the teeth can get loose and fall out.
Talk about the gums as well. Sometimes you have some bleeding out of the gums.
So healthy gums don't bleed, and a part of our goal of treatment is to keep them pink and healthy. It shouldn't be painful to visit the dentist.
Not red.
Not red, not red, inflamed, yes.
What are some of the steps that you can do to prevent? I mean, I know we have daily brushing a couple of times a day.
Daily brushing, flossing. We have the water pick that can help irrigate the pockets. Anything greater than 4 millimeters when you go to the dentist and have measurements taken of your gums, we can't clean. You can't clean at home. So that's why regular dental visits, we recommend 3 months as standard of care for proper perio maintenance to keep control of the bacteria as they try to reintegrate and start creating the inflammation again. So daily brushing, flossing, mouth rinses, Listerine is really good to help get into those pockets and help control the bacteria.
Now, if you are diagnosed with periodontal disease, you said it's chronic, no cure, but what can you do to maintain it or keep it at bay?
Right, so you need to educate yourself and go to your regular dental visits and see a periodontist if referred to a periodontist to get the necessary treatment to hopefully save your teeth, because that's our inevitable goal.
How widespread is it, Dr. Guthrie? Do you see it a lot?
Over 80% of Americans have some type of gingivitis or periodontal disease. So
Gingivitis
yes,
is what?
Inflammation of the gums is the beginning stage, and then the periodontal disease where you start getting the destruction of the bone.
Ultimately, what can it lead to?
Dentures, tooth loss.
And also some serious health issues as well.
So yes, there's other systemic disorders such as heart disease, diabetes, stroke, Alzheimer's. They've linked it to low birth weight in pregnancy, and eventually dentures, yeah.
What are the, you know, obviously we were seeing some cigarettes here.
Yes.
That also leads to it as well?
That's one of the highest risk factors for periodontal disease is smoking, so we really try to kick that habit.
What do you say to your patients when you start to see some of these signs?
Well, we like to
Do you scare them?
I don't want to scare them, but we, you know, we want to educate. So inevitably, our goal is to have teeth for a lifetime. So when we see patients in their 80s and above that have teeth, that we celebrate that. It's pretty awesome to see because that's rare. but people are living longer these days.
Indeed.
So we're working hard to educate when they're young, when we start seeing the signs, to really hit it hard when they're young instead of letting it go to the point of a tooth loss and then, you know, dealing with it later. It becomes more costly.
Is it something, Dr. Guthrie, with someone in their 30s, 40s, or 50s, is that, and they hadn't really taken care of their teeth up until that point, can they start now and it's not a lost cause?
It depends on the person, you know. I do see people for the first time that it is a lost cause, and we have to talk about having, you know, all their teeth extracted and losing their teeth, but hopefully we can catch it soon enough.
Boy.
And get on ball with them to have their teeth for the rest of their life.
Wow, that has to be a very difficult conversation.
It is a very hard conversation.
Dr. Guthrie, it's always a pleasure. Thank you so much for sharing this disease. So, I'm going to go floss right now. For more information on James River Family Dentistry, we are going to post a link on our show website at WTVR.com/VTM. Dr. Guthrie, thank you so much. Keep up the great work.